Well, here's the truth. If you're fully vaccinated, you're safer with a higher degree of protection. But if you're not vaccinated, you are not protected. And now, what we have now is a pandemic of the unvaccinated. And by the way, you know that old expression, you notice a lot of our very conservative friends have finally had an altar call. They've seen the Lord, whether it's on Fox News or whether it's the most conservative commentators.
Hi again, everyone. It's 5 o'clock in the East. In past times of nationwide crisis, we've seen our country unite, come together to guard against a common enemy. But the COVID pandemic has revealed a remarkable divide in this country, one only exacerbated by the vaccine, because as the president mentioned there, we're now seeing a pandemic among the unvaccinated, among those choosing to not take the necessary precautions against a deadly virus, choosing instead to follow conspiracies or put defiance of expert guidance above everything else. Their actions fueled and encouraged by Republicans. As the Washington Post reports, quote, across the country, GOP lawmakers are rallying around the cause of individual freedom to counter community-based disease mitigation methods. Moves, experts say, leave our country ill-equipped to counter the resurgent coronavirus and a future unknown outbreak. In some states, anger at perceived overreach by health officials has prompted legislative attempts to limit their authority, including new state laws that prevent the closure of businesses or allow lawmakers to rescind mask mandates. Some state courts have reined in the emergency and regulatory powers that governors have wielded against the virus. And in its recent rulings and analysis, the U.S. Supreme Court has signaled its willingness to limit disease mitigation in the name of religious freedom. So now, we are left with a new coronavirus surge in the U.S., infections rising in all 50 states, but ones with low vaccination rates are obviously being hit the hardest. And among those hospitalized, 97% of them are unvaccinated. As our country grapples with this split-screen pandemic and concerns of more variants emerging, health experts stress that the only way out is mass vaccination. This leads columnist E.J. Dionne of The Post to pose this question, quote, Republicans unleashed a deadly vaccine skepticism. Can they now contain it? It seems some in the GOP are now trying to undo that damage. There was Senate Minority Leader Mitch McConnell saying we need to get shots in everybody's arms as rapidly as possible. And in the state, which earlier this month accounted for 20% of the country's new infections, that would be Florida, our Governor Ron DeSantis is now touting the efficacy of vaccines, saying, quote, these vaccines are saving lives. They are reducing mortality. There are even public calls of regret among the unvaccinated individuals themselves. A mother in Alabama who lost her son to the virus said this, quote, it took watching my son die and me suffering the effects of COVID for us to realize we need the vaccine. We did not get vaccinated when we had the opportunity and regret that so much now. And conservative radio host in Tennessee, Phil Valentine, who previously said that he would not get the vaccine because his chances of getting the coronavirus were so slim, is now hospitalized and in critical condition after he contracted COVID-19. His station put out this statement, quote, Phil would like for his listeners to know that while he was never an anti-vaxxer, he regrets not being more vehemently pro-vaccine. He looks forward to being able to more vigorously advocate that position as soon as he is back on the air, which we all hope will be soon. Which brings us back to that E.J. Dionne column. It says this, quote, so please, Republican politicians, keep shouting from the rooftops about the imperative of getting vaccinated. But you also need to take another virus seriously. The spread of extremism in your party is deadly to our health and to our democracy. The two pandemics, one of a virus and one of disinformation, is where we start today with some of our most favorite friends. Dr. Peter Hotez is here. He's the co-director of the Center for Vaccine Development at the Texas Children's Hospital, the dean of the National School of Tropical Medicine at Baylor College of Medicine, and author of the book, quote, Preventing the Next Pandemic. Also joining us, our friend Eddie Glaude, chair of the Department of African American Studies at Princeton University and an MSNBC contributor. Also the author of Begin Again, which comes out in paperback tomorrow. I can't believe we're at your paperback release. Wow. And Clint Watts is back, former consultant to the FBI Counterterrorism Division, now a Distinguished Research Institute fellow and MSNBC national security analyst. Dr. Hotez, this is your sort of joint mission. I feel like since the beginning, you've been warning about COVID. You've been explaining to us non-doctors how this virus would surge through our country and our communities. But you've also been warning from the very, very beginning about the dangers of disinformation, especially once there was an abundance of vaccine supply. What do we do now?
That's right, Nicole, and it's very sad. I've been a vaccine scientist for almost 40 years and been fighting anti-vaccine aggression for about 20 years or 23 years. And now it's accelerated. And the game changer is over the last year, or the last few years, the anti-vaccine movement has adopted this political component to it, that somehow that being part of the extreme right or the far right requires you to wage a war of aggression against science and scientists. And we've seen this at the CPAC conference over the last few weeks. We've seen that claimed that vaccines are nothing more than a political instrument of control, or they're going to use it to take away our guns. And as ridiculous as it sounds, unfortunately, it's been believed by many. And then we've seen this number of hearings about emphasizing the side effects of vaccines. All of this has had a very untoward effect. And of course, it's been amplified nightly on the conservative news channels. And now I think what's happened is a number of the members of the GOP have realized they've unleashed a monster, and it's driven down vaccination rates, and it's responsible for this massive surge across the southern states. And you can show a very sharp association between COVID-19 accelerating from the Delta variant and low vaccination rates, very much along a partisan divide. And now people are piling into hospitals. And now the school year is going to be starting in a few weeks down here in the South. So I'm extremely worried now that this is going to filter to the adolescents and the kids, and we're going to start seeing pediatric intensive care units. So yes, I think it's great, as the president says, that now we've got some strong conservative voices that are now saying we have to vaccinate. But, I think that things are too far gone. I don't know how successful they'll be.
I want to ask you about the wear and tear on our public health officials, because we've all covered the firing of the Tennessee Dr. Fiscus. There's some great reporting in the New York Times today about what's happening in Louisiana. Let me read this to you, Dr. Hotez. Let's talk about it on the other side. A year and a half into the crisis, their battered departments are now struggling to contain the spread of the Delta variant, with testing and contact tracing the best resources, despite their limited reach in the many places where vaccination rates remain low. They're facing new heights of hostility, and new battles are looming over what safety measures schools and businesses should put in place in the fall. Decisions the CDC has said should be made in consultation with local health officials. What is sort of the degree of alarm and panic about back to school? I mean, David Leonhardt of the Times writes that even the Delta variant is not proving more lethal among children, but you're right about an uptick in kids if we don't get the vaccination rates up. How do you see this impacting back to school?
Well, it very much depends on where you are. So, in many of the northeastern states and in the West Coast, where almost all of the adults and adolescents are vaccinated, I think I have a lot of optimism about in-person classes. But, you look at a state like Louisiana or Mississippi, where 15 to 16% of the adolescents are vaccinated, 30 to 40% of the young adults. You've got the Delta variant accelerating. You have a number of red state governors saying they refuse to implement mask mandates. We don't give our public health experts much to work with. And, we've got to have something to work with. And if you can't use vaccines and you can't use masks and other non-pharmaceutical interventions, what do you have left? And that's the big worry right now. So in Louisiana, many parishes, the in-person classes are starting August 9th or August 10th. While Delta's accelerating and nobody's vaccinated and very few will have masks. It's hard to imagine how this goes well. And so I do believe we're going to see a lot of adolescents get sick and a lot of teachers and staff get sick, because the difference now is this Delta variant is twice as transmissible as anything we've seen before. So this is the convergence or a perfect storm